There's a lot of complications when it comes to lymphedema, especially unmanaged lymphedema. And I know there's a lot of people out there that are struggling to get care. But there's things that you can do to help protect yourself right now while you're looking for care. What is very common with lymphedema that is not managed or not being treated, as it progresses and worsens, we start to get more deepened skin folds here, which is often kind of this overlooked issue, and it should be discussed more. Um, these folds, which could be around the ankle, around the knee, under the belly, the apron, the arms, they create a warm, moist environment where sweat and lymphatic fluid become literally trapped. And this leads to irritation, maceration. Macerations when the skin is breaking down from too much moisture, kind of like you've been in a pool for too long. It also could lead to fungal and bacterial infections, which ultimately leads to further skin breakdown and wounds. And when you get wounds in these creases, they become a lot more difficult to manage because it's constantly an environment that's just egging on that wound to worsen rather than to improve. I'm going to show you a picture of an irritated fold and what that looks like. So this is not my patient, this is not my photo, this is taken right off the internets. But here I often see this. When I separate folds, you see this red area. It's usually very moist. Sometimes it has a smell to it because of the fungal or yeast that's growing in there. And what can you do to manage it? You have to manage the fluid. You have to manage the environment as best you can. If you're not able to get into a clinic where you're getting therapy for your lymphedema to reduce those limbs, which is the best option, but not, as we know, it's not available for everybody. But there's a couple of tricks that are actually pretty simple and relatively cost effective. The first one that I use a lot in the clinic is zinc oxide. Now this is just one brand of zinc oxide, but zinc oxide is a paste. It's kind of like a toothpaste. Zinc oxide is the same stuff that lifeguards used to put on their nose. It's a skin protectant. It helps protect the skin from moisture. If you've had babies with baby diaper rash, same thing. You put a zinc oxide paste, not an ointment, a paste on there, and what it does is it helps propel water. If you put it on and then pour water on, it's going to beat up and roll off. But it's also a very soothing skin protectant, and it does a really, really good job of mitigating that soreness, that skin breakdown, as long as the skin's not broken wide open where it's a wound. If it's a wound, you need to get that dealt with. But the goal is to prevent that from happening. There's other products on the market now, Dry. This is just a fabric. It's a wicking fabric. And what you literally do with it is you place that wicking fabric within the skin folds, and it helps pull out that moisture to keep that area dry. Meticulous skincare is imperative to good lymphedema management. Whether you've been treated or not, you need to take care of your skin because if you're at a high risk of infection. So you're trying to avoid any type of skin breakage, whether it's moisture issues through the skin's breaking down, insect bites, poison ivy, sunburns, tattoos, cuts, nicks, all those things you want to, at your best, try to avoid. And if it does happen, my rule of thumb is treat your skin like it's a 2-month-old baby. Would you do it to their skin or would you not do it to their skin? And that's kind of the answer. Don't treat it like it's your 10-year-old son's knee when he falls off his bike. Brush it off and move on. You don't want to do that. Treat it like a newborn skin. Zinc oxide paste is an amazing product. It's very affordable, and it would do wonders as a preventative. And you don't slather it. You don't goop it on. A nice thin layer does wonders.